Parametric Q and A and rationals. Physiological adaptation. 1. Your client is receiving brachytherapy. What nursing intervention should you implement for this client? Exclude pregnant visitors from the client's room. Place the client in a negative pressure room. Have all visitors wear protective masks and boots. All of the above. Answer A. You would exclude all pregnant visitors from the client's room in order to protect the pregnant woman's developing fetus. Brachytherapy is internally placed radioactive material to treat clients who are affected with tumor and cancer of the prostate, lungs, esophagus, cervix, endometrium, rectum, breast, head and neck. Some of the other special internal radiation precautions include the minimization of the duration of time that healthcare providers are in the client's room to deliver care and services to the client. The placement of the client receiving internal radiation in a private room. A negative pressure room is not indicated for this client. The prohibition of the client's activities outside of their room. The initiation of complete bed rest for the client until the treatment is discontinued. The provision of education to the family members and other visitors that includes information about their need to limit the time of their visits to at least less than 1 hour, to stay at least 6 feet away from the client. The need for healthcare staff to minimize the amount of time spent in the room, to decline to enter the room if they are pregnant, to retain all supplies and equipment including things like bed linens in the client's room until they are deemed safe for disposal by a person who is competent to make this decision, and how and when to report concerns about the client's treatment such as when implanted seeds inadvertently leave the client's body. 2. Which of the following is an adverse effect to therapeutic radiation therapy? Fibrosis, alopecia, oral dryness, xerostomia. Answer A. Fibrosis is an adverse effect to therapeutic radiation therapy. Radiation fibrosis can affect bones, nerves, ligaments, muscles, blood vessels, tendons, and the heart in addition to the lungs. Fibrosis occurs as the result of abnormal fibrin and protein accumulation within normal irradiated tissue. Alopecia and oral dryness, which is also referred to as xerostomia, are side effects and complications to radiation, but not adverse effects. Other side effects, complications and adverse effects associated with therapeutic radiation therapy are skin damage, damage to the mucosa, dental caries and oral infections, fatigue, nausea and vomiting, anorexia, diarrhea, bone marrow suppression and immunosuppression, radiation pneumonia, cataracts. 3. Your client is receiving phototherapy. What nursing intervention would you implement for this client? Placing the client in the Trendelenburg position. Monitoring the color of the stools. Using a Hoyer lift for patient transfers. Monitoring the arterial blood gases. Answer B. You would monitor the color of the stools for the client who is receiving phototherapy. Phototherapy is used to treat psoriasis, but it is most commonly employed for the treatment of neonatal hyperbilirubinemia and jaundice, which can occur among both full-term and preterm infants. You would also monitor and document the client's skin for changes in color that may indicate an increase or decrease in the amount of bilirubin in the client's blood. Laboratory bilirubin levels to determine whether or not the client's bilirubin levels are decreasing as the result of the phototherapy. Volume, color and characteristics of the stool, because phototherapy can lead to frequent, loose stools as well as a color change to green-colored stools. 4. Select the risk factor that is accurately paired with its disorder. Hypokalemia, hypermagnesemia. Hyponatremia, dehydration. Hyperkalemia, ketoacidosis. Hypercalcemia, hypoparathyroidism. Answer C. Ketoacidosis is a risk factor for hyperkalemia. The risk factors for the other electrolyte disorders above are hypokalemia, diarrhea, vomiting, and diaphoresis, as well as some medications like diuretics and laxatives, and with other disorders and diseases such as ketoacidosis. Hypermagnesemia is not a risk factor for hypokalemia. Hyponatremia, thyroid gland disorders, cirrhosis, renal failure, heart failure, pneumonia, diabetes insipidus, Addison's disease, hypothyroidism, primary polydipsia, severe diarrhea or vomiting, cancer, and cerebral disorders. Dehydration is a risk factor associated with hypernatremia, not hyponatremia. Hypercalcemia, hyperparathyroidism, not hyperparathyroidism, some medications such as thiazide diuretics and lithium, some forms of cancer such as breast cancer and cancer of the lungs, with multiple myeloma, Paget's disease, non-weight-bearing activity and elevated levels of calcitriol as occurs with sarcoidosis and tuberculosis. 5. Select the risk factor that is accurately paired with its disorder. Hypernatremia, hepatic failure. Hypocalcemia, vitamin A deficiency. Hypermagnesemia, Cushing's disease. Hypomagnesemia, Crohn's disease. Answer, D. Crohn's disease is a risk factor for hypomagnesemia. Other electrolyte disorder risk factors include hypernatremia, dehydration, renal failure, hyperglycemia and Cushing's disease. Hypocalcemia, vitamin D deficiency, Crohn's disease, sepsis and pancreatitis. Hypermagnesemia, Addison's disease, renal failure, diabetic ketoacidosis and dehydration. 6. Select the electrolyte that is accurately paired with its normal level. Phosphate, from 0.81 to 1.45 millimoles per liter. Chloride, from 60 to 110 milliequivalent/L. Calcium, from 6.5 to 10.6 mg/dl. Potassium, from 3.7 to 7.2 milliequivalent/L. Answer, A. The normal level of phosphate is from 0.81 to 1.45 millimoles per liter. The other normal levels for these electrolytes are chloride, from 97 to 107 milliequivalent/L. Calcium, from 8.5 to 10.6 mg/dl. Potassium, from 3.7 to 5.2 milliequivalent/L. 7. Identify this cardiac rhythm strip. Idioventricular rhythm. Bundle branch block. Sinus bradycardia. Atrial flutter. Answer, C. Sinus bradycardia is a sinus rhythm that is like the normal sinus rhythm with the exception of the number of beats per minute. Sinus bradycardia has a cardiac rate less than 60 beats per minute. The atrial and the ventricular rhythms are regular. The P wave occurs prior to each and every QRS complex. The P waves are uniform in shape. The length of the PR interval is from 0.12 to 0.20 seconds. The QRS complexes are uniform and the length of these QRS complexes are from 0.06 to 0.12 seconds. 8. Identify this cardiac rhythm strip. Asystole. Atrial flutter. Supraventricular tachycardia. Premature atrial contractions. Answer, B. Atrial flutter, which is a relatively frequently occurring tachyarrhymia. This cardiac rhythm is characterized with a rapid atrial rate of 250 to 400 beats per minute, a variable ventricular rate, irregular atrial rhythm, a possibly irregular ventricular rhythm. The P waves are not normal. The flutter wave has a sawtooth look. F waves, the PR interval is not measurable. QRS complexes are uniform and the length of these QRS complexes are from 0.06 to 0.12 seconds. 9. Identify this cardiac rhythm strip. Torsades de pointes. Accelerated idioventricular arrhythmia. First-degree atrioventricular heart block. Supraventricular tachycardia. Answer, D. Supraventricular tachycardia, simply defined, is all tachyarrhythmias with a heart rate of more than 150 beats per minute. the atrial and ventricular cardiac rates are from 150 to 250 beats per minute. The cardiac rhythm is regular. The P wave may not be visible because it is behind the QRS complex. The PR interval is not discernible. The QRS complexes look alike, and the length of the QRS complexes ranges from 0.06 to 0.12 seconds. 10. Identify this cardiac rhythm strip. Third-degree heart block. Second-degree atrioventricular block, type 2. Ventricular fibrillation. Premature atrial contractions. Answer, C. The two types of ventricular fibrillation that can be seen on an ECG strip are fine ventricular fibrillation and coarse ventricular fibrillation. Ventricular fibrillation occurs when there are multiple electrical impulses from several ventricular sites. This results in erratic and uncoordinated ventricular and/or atrial contractions. 11. You are going to perform gastric lavage for your adult client who was accidentally poisoned. How many ml of irrigating solution would you instill after each suctioning? 100 ml, 250 ml, 400 ml, 500 ml. Answer, B. You would instill 250 ml of irrigating solution after each suctioning of the nasogastric tube. The typical amount of irrigating solution is from 20 ml to 300 ml. 12. Your client has superior vena cava syndrome. The client's wife asks you what this is. How should you respond to the client's wife? You should explain that superior vena cava syndrome is the compression of the renal medulla, syncope and dizziness of unknown origin, pressure on the vena cava, which is a major vein in the body, pressure on the vena cava, which is the largest artery in the body. Answer, C. You should explain that superior vena cava syndrome is pressure on the vena cava, which is a major vein, not an artery, in the body that carries blood from the systemic circulation to the right atrium of the heart. This pressure on the superior vena cava prevents the normal return of the body's circulating blood to the heart. The signs and symptoms of superior vena cava syndrome include tachypnea, dyspnea, venous stasis, a loss of consciousness, edema, seizures, respiratory and/or cardiac arrest, and not syncope of unknown origin. This is a life-threatening medical emergency. 13. Your client has presented in the emergency department with a sudden onset of shortness of breath, dysphagia, dyspnea, coughing, and pain in the chest, arms, neck, and back. Which of the following would you most likely suspect? Hypovolemic shock, septic shock, a dissected thoracic aortic aneurysm. Answer, C. You would most likely suspect that this client is affected with a dissected thoracic aneurysm. Thoracic aorta rupture and dissections can present with symptoms that can include shortness of breath, dysphagia, dyspnea, coughing, and pain in the chest, arms, jaw, neck, and/or back. The signs and symptoms of hypovolemic shock vary according to the stage of the shock. Some of the signs and symptoms include hypotension, tachycardia, a lack of tissue perfusion, hyperventilation, decreased cardiac output, decreased urinary output, oliguria, anuria, metabolic acidosis, increased blood viscosity, and multisystem failure. The signs and symptoms of septic shock include the classical signs of infection in addition to hypotension, confusion, metabolic acidosis, respiratory alkalosis, abnormal breath sounds like crackles and rowels, a widened pulse pressure, and decreased cardiac output. 14. Intussusception occurs when part of the intestine slides into another part of the intestine. The appendix ruptures. An ileostomy stoma retracts below the abdominal surface. Lungs are infiltrated. Answer, A. Intussusception occurs when a part of the intestine slides into another part of the intestine. This medical emergency can lead to poor perfusion to the intestine. The signs and symptoms of intussusception include knee to chest posturing, abdominal pain, bloody stool, fever, constipation, vomiting, and diarrhea. A ruptured appendix occurs when an infected appendix ruptures, a stoma retraction occurs when an ileostomy stoma retracts below the abdominal surface, and pneumonia occurs when the lungs become infiltrated. 15. Which intervention would you expect to render to the client in a sickle cell anemia crisis? The administration of a thrombolytic medication. The administration of hydroxyurea. Placing the client in the Trendelenburg position. Placing the client in the lithotomy position. Answer, B. You would expect to administer hydroxyurea, which prevents the sickling of the client's red blood cells. You would not administer a thrombolytic medication, however, you would likely administer analgesic medications for the pain associated with the sickle cell crisis. The lithotomy position is used for procedures involving the pelvis, including gynecological examinations, and the Trendelenburg position is used when the client is in shock and with significant hypotension. 16. You are having a nice dinner in a fancy restaurant. As you are eating, you hear the gentleman eating at the next table start to bang the table, hold his throat and forcibly cough. What should you do? Perform the Valsalva maneuver. Encourage the person to continue coughing. Perform the Heimlich maneuver. Begin CPR and prepare for ACLS measures. Answer, B. You would encourage the person to continue coughing because this person has a partial airway obstruction. You would perform the Heimlich maneuver when the person has a complete airway obstruction. CPR and ACLS may be necessary later, but not now, as based on the fact that the person only has a partial airway obstruction. Lastly, the Valsalva maneuver is done when one exerts pressure against resistance. 17. Pelvic inflammatory disease is most often caused by trichomoniasis, E. coli, Staphylococcus aureus, Neisseria gonorrhoeae. Answer, D. Pelvic inflammatory disease is most often caused by the Neisseria gonorrhoeae and Chlamydia trachomatis pathogens, and it most often occurs as the result of untreated salpingitis, pelvic peritonitis, a tubo-ovarian abscess and/or endometritis. Unlike Neisseria gonorrhoeae, trichomoniasis and infections caused by E. coli and Staphylococcus aureus are not associated with the onset of pelvic inflammatory disease, which can lead to infertility, increased risk for ectopic pregnancies, sepsis, septic shock and death when left untreated. 18. What type of immunity occurs when a person has an infectious, communicable disease like the measles? Adaptive immunity. Passive natural immunity. Active natural immunity. Active artificial immunity. Answer, C. The type of immunity occurs when a person has an infectious, communicable disease like the measles is active natural immunity. Active immunity occurs as the result of our bodily response to the presence of an antigen, with the development of antibodies. Active immunity can be both natural and artificial. Natural active immunity occurs when the body produces antibodies after the client is infected with a pathogen, and artificial active immunity occurs when the body produces antibodies to an immunization vaccine such as those for pneumonia and a wide variety of childhood infectious diseases. 19. Your client is experiencing general malaise. Which stage of infection is this client in? The incubation stage, the illness stage, the prodromal stage, the convalescent stage. Answer, C. The prodromal stage, or phase, of the infection process is characterized with general malaise, joint and muscular aches and pains, anorexia, and the presence of a headache. The prodromal stage begins with the onset of symptoms, and this stage is characterized with the replication and reproduction of the pathogen. The incubation stage is asymptomatic. The illness stage is the period of time that begins with continuation of the signs and symptoms, and it continues until the symptoms are no longer as serious as they were before, and the convalescent stage is the period of recovery during which time the symptoms completely disappear. 20. Which statement about automated external defibrillators is accurate? They are not as effective as regular defibrillators. They are replacing regular defibrillators in acute care settings. Only BLS-certified people in the community should use them. They can be easily used by people with no healthcare experience. Answer, D. Automated external defibrillators can be easily used by people with no healthcare experience. Automated external defibrillators are simple to use, and there is no need to be able to recognize cardiac arrhythmias or interpret cardiac rhythm strips. Automated external defibrillations are intended to be used by the general public without any healthcare or nursing knowledge of experience, therefore, they are not restricted to only those BLS certified. Although they are highly effective, they are not replacing the standard defibrillators in the acute care setting.